And as soon as I became ordained, that's when everything started to shift for me. My whole career absolutely changed at that point. Everything that's happened since then I consider to be a supernatural miracle of the Lord. And one of the biggest supernatural miracles wasn't even initially the healings that I was seeing, but the fact that so many hospitals all of a sudden were opening to this work that he was guiding me to do, which is very unusual. Doctors, even in my field, don't go from hospital to hospital seeing miracles. We just don't see that. Even if you're a doctor who prays for your patients, and very few of us do, most of the people in my field are not praying for miracles. I've spoken to many doctors across the country, and we tend to focus on good outcomes in what we're doing. A surgeon will pray for a patient who he's going to operate on to come out of surgery in good shape. We don't want you to have terrible side effects from anesthesia, where your brain is basically really messed up from the anesthesia. We want you to heal quickly. We want you to not have complications. And a lot of the doctors that I spoke with, that was kind of how they were praying. What they weren't praying for was miracles, where you don't even need the surgery, where the doctor's practice has a lot of people coming in for surgery and they leave without the surgery because the Lord has healed them. Because I would share with doctors what I was experiencing in the hospitals, they would start to think, gee, I really think I need to start praying a little more aggressively into what the Lord can do. Lights went on in their heads, so I don't know how many of them actually did that, but it was interesting to see what was going on in my field, even with physicians who were praying. So what the Lord had me do in terms of this amazing experience of being in the hospitals, and I was in hospitals from San Jose all the way up to San Francisco. For example, if I was in the Palo Alto Veterans Hospital, I was also in the San Francisco Veterans Hospital and Kaiser hospitals all over the Bay Area, Stanford Hospital, County Hospital. And a lot of my time was spent in the ICUs. I was working with the very sickest, most critically ill patients. What the Lord did with me was he had me with patients who were just absolutely in disastrous situations. So I was in the medical ICUs, the cardiac care ICUs, the trauma ICUs, the rehab ICUs. I was just with the very sickest patients. And what was very exciting to me was that he still guided me to do exactly what I had been doing with my own practice. But even more, he was starting to show me outcomes that I had never seen. The Lord was showing me amazing healings. I prayed for many people who just in the medical way of looking at it just didn't have any future for being healed. Like I saw an army of quadriplegics walking, and lots of them when I was in the hospital. And I brought at least one of these cases tonight. I have many pictures of many different quadriplegics and people who were wheelchair bound. Many, many miracles. It just was wonderful for me to see. Because each one of those people represents someone for whom their life forever, every remaining day on the earth, was going to be completely limited in terms of what their function is.